Mind Deconstructed, Mental Health and Wellness with Dr. Kaz and George.
The statements of Dr. Kaz and George are not a substitute for medical care, and our opinions are our own. If you are experiencing a mental health emergency, please seek assistance from a professional in your area.
You can contact us via Twitter at Mind Deconstruct. I'm your host, George. With me is Dr. Kaz. Dr. Kaz Nelson is an American Board of Psychiatry and Neurology certified psychiatrist, licensed to practice medicine in the state of Minnesota, and an assistant professor in the Department of Psychiatry at the University of Minnesota Medical School. On today's episode, Dying of Shame.
Very weighty title.
Very catchy title.
You think so?
I like it. It might have been the title of a Game of Thrones episode. The shame lady behind Cersei walking down the street. Shame. Shame.
You're right. I couldn't forget that episode.
Shame.
Would you say that scene cut to the core?
If I were in Cersei's position, I would be feeling a lot of shame, not necessarily because of my actions, but because I'm being marched through the street naked while someone is chanting shame. That would be a thing.
Mm-hmm. Sting a bit.
Yeah, I wouldn't find that fun. Is that shame, perhaps?
That's a good question. We're going to learn about shame today, and maybe we'll come to some conclusions about that.
For our hot topic in mental health, we are going to touch on shame a little bit. The death of Mark Salling, actor in Glee, who committed suicide just prior to doing a little prison time for some child pornography charges. And then there's also the Dan Johnson, the legislator in Kentucky, who took his own life after being accused of molestation. Those are two very high-profile instances of potential public shame leading to a death.
That's right.
That is an extreme reaction to a situation that certain people find themselves every day, and it doesn't necessarily result in their death.
It certainly is a permanent and irreversible action related to a temporary issue. I think when I saw those news articles come through, I just felt heartbroken about the circumstance, because I think when people feel so much shame, it's intolerable, and people feel that suicide is the only way out. And it breaks my heart when people feel they're in that position, regardless of what brought them there.
So what is shame? Is it just when I feel guilty about doing something?
No, it turns out shame is its own discrete emotion, and it's actually different from guilt. Guilt is when you feel badly about doing something because it clashes with your internal values. So if I believe that stealing is bad, and yet I go ahead and steal something and maybe nobody found out, I might have a sense of guilt because I've done something that clashed with my values.
So then shame is the more public aspect or side of that?
Yes. Shame is when your tribe or other people, those in your community, see you doing something or feel that you've done something that clashes with the community standards. And it's that very public experience.
So that really is kind of the crux of what the Game of Thrones lady was getting at, marching Cersei through the street for everyone to look at and calling shame. Like, that's the whole thing.
That was a move to maximize shame, absolutely.
So why do we feel shame then? Why is that an emotion that I need to have?
Right. I always enjoy pinning things to our early ancestors, because that gives us a lot of information about how our inner alarm bells, our inner dangerousness, safety monitoring systems work today. Turns out that back when we were cave people and early human beings, when you lived in a family or a tribe or a small community, you really relied on one another to survive. You might have a couple people that are hunters who go back and bring food back to the group, and it was critically important for you to be on the same page and working well with those around you, because if you were shunned or sent out of the tribe, chances are you would die, because people alone out in the wilderness were not able to survive. It made it very difficult. And so our inner wiring came up with these alarm bells to say, oh, you're different from the group, or you're clashing with the group values, and that's how shame is induced.
You and I grew up together because we're brother and sister.
That's right. You're my little brother.
Yes. When we were younger, and say, if our mother publicly scolded us in front of the rest of the family, would she be shaming us instead of guilting us?
Right. In those moments, depending on if we did something we should feel guilty about or not, we might be feeling some guilt if we did something that we know we shouldn't have done and that we knew was the wrong thing to do. But that public piece of it, where other people were seeing it as well, and grandma finds out, that could be the shame element of it.
So how is that related to then like social anxiety? Is that just the fear of shame?
Yeah. When we talk about social anxiety or people that avoid or feel tremendous stress related to social interactions and social situations, part of that is the fear or the worry about judgment because of the potential for shame. So I would say that the emotion of shame is tied into certain aspects of social anxiety.
As a psychiatrist, why are you talking about shame, which is just an emotion that people have?
Well, the reason why it comes up for me over and over again is because of how painful shame is. People have trouble tolerating it. And if other coping mechanisms are not really well developed, oftentimes people think, I feel so much shame, this is so intolerable, that death is a solution to this, which it's not. And so I get very, very concerned about the role of shame in people's survival. Shame can be fatal.
So even if I don't have necessarily an underlying mental health issue, I could feel shame to such a degree that I think that I should take my own life, and that would be better than dealing with my perception of other people's view of me.
Yeah, that absolutely happens. I think when we see people who maybe have died by suicide and we think, oh, well, they must have had depression or something like that. And I think I've talked about in other episodes that suicidal thinking and suicidal behavior are not connected with any one mental health disorder. We see it across mental health disorders, but we also see it in people who don't have mental health disorders but are experiencing an emotion that's intolerable. And shame is the biggie.
So then, as a psychiatrist, how are you dealing with people's intolerable shame or those sort of fatal shame issues?
One thing we try to do is work with people to understand whether the shame is warranted. There are a lot of people who have certain expectations for themselves, perfectionistic standards, high standards that feel that if they do one thing imperfect or not quite right or break a rule that they forgot about and should have followed, that amount of shame warrants some major action like quitting one's job or engaging in suicidal thoughts or behavior. And there's oftentimes we can look at something objectively and say, yes, that was a mistake, or yes, somebody saw that you didn't follow that procedure correctly, but that's not a reason to have a shame reaction that is fatal for you or damaging to your overall life and trajectory. It is possible to make mistakes, learn from them, and move on.
Is there any, like in anxiety, we had some tips and tricks for dealing with it? Is there anything to help with the shame?
Yes. I'm so glad you asked that. Whether the shame is warranted or not, there are things that people can do that's, again, one of these life hacks or self-management tricks to reduce the intensity of the shame to allow you to be more effective in solving the problem.
For a person who says she doesn't like the word life hack, you've used it in 2 episodes now.
Well, I just want to get at the idea that these are things that you can do that make life simpler and easier. And yeah, I do hate the term, and I use it. So you're going to shame me about that publicly.
Sorry about that.
I'll endure. So here's how you reduce shame. Number 1, you have to realize you're having shame, that you're not necessarily feeling sadness or anxiety or different things. Learn where you feel shame in your body. For me, interestingly, it's in the top of my scalp. The top of my scalp gets very hot and tingly, and that's how I know I'm experiencing shame, but it's different for every person. And then the technique that we use to reduce the intensity of shame has a name. It's called doing the opposite to emotion action.
That's catchy.
Do you like that?
No.
Oh, opposite to emotion action. Its title is exactly what it says. So when you feel shame, you're going to have an action urge. That might be pulling the covers up over your head, or not talking about things to loved ones, or shutting off your social media accounts, something like that. The technique to then reduce that shame is to notice what is my action urge, and then to do the opposite of that very mindfully. So if your urge is to pull the covers up over your head, you're going to do the opposite, and you're going to very mindfully pull the covers down over your head and hold your head up high with your chin up. And doing those actions and behaviors feeds signals to your brain that reduces shame.
So what is the opposite to the action for someone who wants to delete their social media account?
Mm-hmm. I think it depends on a case-by-case basis, but when it comes to social media and those types of shame, it's a little bit tricky because there might actually be healthy ways of reducing your social media usage, or not just reading comments from people of things that you have said. There might be a healthy aspect to that. But if your urge is to withdraw from a community, the opposite action would be to engage with the community.
Okay. So when dealing with social media, that is a whole different beast. We talked about the hunter-gatherers needing their cohort to survive. Now the cohort could be millions of people.
Right.
Some of them are not very nice.
Mm-hmm. And there's the anonymity of the internet.
Oh, yeah. So much negative trolling out there. People who are mean because they can be, or just say anything they want because of the anonymity. And then people internalize that, or I would assume have shame responses. I don't know. I'm not really on the social media scene. Probably to avoid shame. I don't know, but...
Mm-hmm. There's been a function in that for you, in that it decreases the risk of unintended shame.
Yeah, I don't say anything stupid on Facebook because I'm not on Facebook.
Mm-hmm. Right. And that's an extreme way of managing one's exposure. I'm very concerned about the role of shame and social media and the way the internet facilitates these very public venues. I think it's one thing to go through an awkward phase in adolescence and early adulthood. We've all said things in those years that we regret saying, and we're misinformed or misguided. Now you say that on the internet, it can stay in your profile or stay online for people to search later on. I think we really have to equip ourselves to manage that shame and to engage in best practices to reduce the potential for risk in that area, because we've seen that shame be fatal in some instances, and our ancestors did not anticipate us having access to the entire globe with one stroke of a key.
I mean, teen suicide based on social media was perceived as bullying, but really being a shame response, I would assume, to bullying or online directional community content. That's exactly what we're talking about.
It's a severe form of aggression that's extremely difficult for anybody to tolerate, much less adolescents who are vulnerable and have a tendency to feel big emotions because that's the phase of their development.
We can cut this out, but do you want to hear my biggest shame element of my adolescence?
Let's lay this track down.
In my senior yearbook, my little quote, what I attempted to do was put a James Bond quote down there, and I attributed it to James Bond, but it was below the line, and they did not include the reference to James Bond. So my senior quote is just live and let die. It's extreme shame. I feel a flush in my face currently.
I don't get it. Why is that shameful?
Because it's so stupid. And it's also like the opposite of my actual, life philosophy. You know what I mean? Like being in social services my entire life in public service. It's not, like that's just...
It's incongruent to your identity.
Yes. And so just like in that moment of trying to fill out that stupid form, now forever, I can't look at my yearbook.
Yeah. So we could talk about whether that's a warranted shame response or an exaggerated shame response. It's possible that because of your phase of development when you wrote that had a bigger impact than it needed to have. But it left a scar of shame that's haunted you to this day.
Yeah, I feel it.
Yeah. Where do you feel your shame?
Right now, it's like my T-zone on my face is feeling very moist.
Moist, warm, and flushed. Well, I feel a little shame about my yearbook quote. Just because it was oddly precocious, it said, I'd like to be a psychiatrist when I grow up one day.
Oh, that's amazing.
You might find that amazing. I find that a little bit odd for a high school senior to say that and then do that.
It's very, very on the money. I don't know.
Well, these kinds of things are small potatoes in the grand scheme of things. Then you have people who endure attacks from across the globe, are just taken down in every venue online or in the media or in person. And it's hard to imagine how people survive that given how painful that shame response is. And so I just want to raise this issue for discussion because of the role in shame and death as a fatal outcome. And we all have to stick together to reduce this outcome. It's the worst possible thing that can happen.
Gosh, it kind of did feel better to talk a little bit about. I mean, that if that was the opposite to the.
That's right. Putting that out there, and your urge was to hide that information. Instead, you shared it. That's actually going to bring down the shame response. And next time you think about this, you might feel a little less flushed in your T-zone. That's the role of therapy.
Yeah, thank you. I mean, these aren't meant to be personal therapy sessions, but I've been maybe piggybacking a little bit on them. So thanks for that.
You know what? It's free, and it's for you.
Yeah. Thank you for joining us today. This podcast was produced by Kaz and George. Music by Paul.
He's the best.
Contact us and send us your questions on Twitter @MindDeconstruct.